So taking a CBCT, the way we explain it to patients is that it's a little bit more radiation than a banana, and we have a super cute picture of a banana next to the 3D machine. We ask patients if they would like to wear the lead apron. It is no longer recommended by the ADA to wear a lead apron. The choice is the patient's. Some say yes, some say no. And so we allow that to be the patient's choice. We take the image. The way we explain it to patients is that it initially does a scan, which goes around your head. And then the second time, it does the actual 3D. Stay still for 2 minutes, gently bite down. If it's for an implant, we'll put a cotton roll so that we can separate the soft tissues a little bit better. And then the patient goes, sits. It takes me 2 to 3 minutes to read the CBCT, and this is what that looks like. So the first thing I do is I trace the airway. That is where I start. So I make sure that the midline is in alignment in the CBCT, and I trace the airway and I do an airway analysis. So this gives us a good outline of the airway. And then the AI of the computer also provides a histogram analysis, because part of my comprehensive consultation is that we are screening for sleep apnea as well. And also, because I'm doing sedation, I want to know what the patient's airway is going to look like in case we have an emergency. And also for my team, they know how much oxygen to put. If their oxygen levels are low, they go back and they're looking at the histogram. So it's really, really important information for us. Then the next thing I do is I generate a PANO. I share this PANO with my referrals. A lot of docs in town don't have PANOs just yet. And so this is great for them, and it helps them with insurance claims and, just having that overview versus an FMX. So we start with the PANO next. After the PANO, I am looking at the TMJ. So I click on each condyle, and then again, the artificial intelligence from the CBCT looks at the condyle, and this as a part of our head and neck exam, when we have the patient open and close and we're feeling for that crepitus or popping or locking, I can show the patient, this is what your bone looks like. When you hear that popping, it's the bone rubbing against the bone. And so that visual is really important. Also, if the general dentist has recommended a night guard, this helps reinforce why we need a night guard and showing them abfraction, lesions, tori, that kind of stuff. So it helps my consultation, and it helps as a visual for the patient. And then the next thing I do is I go tooth by tooth by tooth by the computer and software lets me click on every single tooth. So I'm going at every single tooth, looking at every view, and then screenshotting any bone loss that I'm seeing. And then I hit save and I go in, start with a health history, and then we have a TV in front of the patient chair, and we put up that 3D and we go through it with the patient. So I will show you guys what that looks like, and thank you for tuning in and listening. I had a lot of requests on this video, so if you have any other requests, just drop it down in the comments below. If you have any questions, drop them down in the comments below. I gave up coffee for a month, so I feel like I'm talking really fast. But anyways, thank you guys for tuning in, and I hope you have a wonderful day.